call the May 4th, 2020 Health Committee meeting to order. We have all members except Mr. Wendt present, so we do have a quorum. We have minutes from April 6th regular meeting to approve. Can I have a motion to approve minutes? Motion by Chung, second by Robustelli. Are there any additions or corrections? If none, all in favor? Any opposed? Okay, minutes are approved. Moving on, oh, do we have any members of the public?
We do not, Chairman.
Thank you. Moving on to departmental matters. I don't know if it's going to be Cassie or Camille on the nursing home. All of you should have received a memo earlier today from Ms. Rodriguez on the nursing home report. So that had, instead of having it in our packet. So Ms. Rodriguez, I'm going to turn it over to you.
Well, thank you. Thank you, Chairman Schaefer, and thank you, Health Committee, for your grace. I know that with the additional responsibilities that the entire county administration team has taken on with the nursing home, while we're actively recruiting for Cindy's replacement, I did obviously not finish this until today. We tried to add some of our initial thoughts about areas of focus that we're going to work on tackling while we're recruiting, but especially as we interview and select an individual for this very important leadership position. With that said, I also want to add that I put some information about COVID in this report. Some of you wisely noted some new initiatives and information that you wanted me to touch upon. I can talk more about it should you have questions about that or anything in the report. And it is true, Ms. Taylor is in the room. She has been actually physically present at the nursing home most days. We made a choice to do all hands on deck, but perhaps not all of us physically going out there, because we are actually trying to limit the number of different individuals that are entering in and out of the facility. And so Ms. Taylor agreed to do that portion of the actual in-person work, but we still don't even have Ms. Taylor enter into the residential portion of the facility. She stays on the administrative side, still following all PPE requirements, et cetera. So those are just little small tidbits, but we're truly connecting with staff. They seem to be very receptive to us. I actually carry yet another telephone because there has to be a abuse, neglect reporting and disaster reporting mechanism. And so I'm carrying the phone, Cassie's going out there, Ms. Dreyer's working on the finances, and Ms. Butler, who you haven't met yet, Michelle, is our new HR manager, and she's working on already doing some screening of candidates for the nursing home administrator position. And I think we're going to be set to do some preliminary interviews this week. So with that said, Ms. Taylor is here behind me if you need her to come up to the podium, but we're happy to answer your questions.
That's a very good memo. I just want to make a comment about that highlights what you've been doing. Does anyone have any questions regarding the nursing home? And welcome, Mr. Wendt. Mr. Robustelli.
Sorry about that. I just want to also echo what the chairwoman said. I thought this memo was really excellent. Really appreciate you laying out so soon after a transition, sort of your thinking. I wanted to touch on the bottom of page 3. As everyone knows, last month I brought up this topic, and that's the topic of how we can be proactive and a thought leader around asymptomatic surveillance and testing. You mentioned the Governor Pritzker had announced an initiative that would provide free testing in nursing homes for both the residents and the employees. And the guidance, as I understand it, was urging long-term care facilities without COVID-19 positive cases to test their residents and employees. And in the next paragraph, I think you do a really good job of sharing how you're going to go about how we've approached this and that the regional testing site is free. And but what I don't understand is we're still limiting it to when and if symptoms are exhibited with regard specifically to staff. And so I just wondered, are there any plans to get staff testing done in some cycle so that we can do a little more surveillance in terms of asymptomatic spread possibilities and do everything we can to prevent that in the facility?
Sure. Thank you, Carlo. And, certainly we have thought about the asymptomatic portion of this disease. It affects all of us, whether we're healthcare workers or not. The challenge has been navigating the time that an individual should self-quarantine once they are tested, and then manning a 24/7 facility. So I've been working also quite closely with Jessica McKnight as she actually gets much more information directly from IDPH even than I do. And we've been trying to manage through the thought process on that, because even if rapid testing is done, if 48 hours is the turnaround time on a test, and I would find a way to test all of the staff within the nursing home, for example, I still have to send them away for 48 hours. So do I, and then do I actually make an employee who feels healthy and is not feeling like they have any reason to go out to the testing site? Can I require them to be tested? And I've been working with our legal staff on that. I know Jessica Woods is on the call and she was helping me navigate those things. So I guess for us, it is the challenge day by day of keeping the right amount of staff in the nursing home for the ratio of patients to nursing staff, and how we would mitigate ourselves should we send away staff to get tested, and they would have to wait at a minimum if we were able to participate in the Quest diagnostics program that the governor mentions for the rapid testing. Otherwise, if we were to send all asymptomatic staff out to the testing site, it would be 4 to 7 calendar days, as I mentioned in the memo. So at this point, it is using the tactics that have been laid out on page 3 more towards the center to keep everyone safe and healthy that we've been employing in this regard, because we haven't figured out yet how we would send away staff. The other challenge, and this has been a challenge for us in general with the nursing home, aside from COVID, is the percentage of our staff that are agency staff, and how many of those staff may or may not work in other facilities as well. And so sending them for testing would also affect their employment and their capabilities in fulfilling their obligations as an agency staff. And so then do we only test the McLean County staff? It's a challenge. We continue to discuss it. We're open to all of these strategies that it will take to keep our facility as it has been, which is 0 positive COVID cases on staff side and on resident side. We're working hard to do that. And so I feel like I'm not answering your question, but I'm sharing with you the challenge of balancing the answer. I'm sorry, go ahead.
No, I really appreciate it. And I think this is one of these examples of where, because this is this global pandemic and the way it's rolled out and the way it's acutely impacted long-term care facilities, I think our HR policies have not quite caught up to the reality on the ground. And so, I mean, because there's 2 parts of this. One is we test someone who's asymptomatic, and then we are required, or it would be a best practice for them to no longer be eligible to report to duty. However, if they are asymptomatic and they're spreading it, we will have a far worse problem with regard to reporting to duty among the staff and the residents we serve. And so, to me, this really is a temporary problem, because for the governor to be able to execute his vision, the state is going to change policies around this. They're going to say, no, you do not need to, it makes no sense. So we're caught in this in-between stage. And I just would say, unless it's absolutely mandatory, because to me, what we're basically saying is we're putting HR policies and those kinds of guidelines ahead of what we know. And what we know is 25% of those who have COVID are asymptomatic. And what we know is almost 50% of those that have died in long-term care facilities. So those statistics tell us that we have a very vulnerable population, and we should be doing everything we can to prevent the spread of this. And we are so uniquely positioned. I wouldn't say this. I mean, you can't even look around the state. There's no other place, almost no other place, that has testing capacity like we do. It won't impact the testing center to send some of our staff to the testing center and some with some frequency just to get a sense. So I know it's complex, and I really appreciate that you continue to look into it, and I'm hopeful that the state will come up with solutions. But to me, that's the stage we're moving into, is prevention. And the only way we're going to do that is if we test a lot of people, and we continue to test them as to prevent the asymptomatic spread that our residents are vulnerable to.
Well, and I think that about the only way you could really do that to totally prevent that anywhere in any nursing home or any congregate facility is to have one of those machines that'll give you an answer in 15 minutes and test you then. You know, when you go into work, test you then, and you can't walk in the door until you've got a clean test right then and there. I think that's the only way we're ever going to be able to guarantee that kind of complete safety on that issue at this point in the game, because it just takes too long. Anyone else have a question? Ms. Metzger.
I agree with you, Chairman Schaefer, primarily because the person can walk out the door and be exposed at home. You know, we have no control, and they can come back in the facility, and they could have been tested 3 days ago and were clean, and then a week later they could potentially unwittingly expose themselves. And so the only way that we could guarantee is a test every single day, and that's not possible. That's not reasonable. So, and Member Robustelli, I totally agree with what your approach, that we've got a vulnerable population. We have the ability to test, but we're going to be testing and potentially not really being able to control the situation.
And maybe when Jessica comes, but could somebody go to the drive-in testing site more than one time? Will they allow you to be tested multiple times?
Yes. Yes.
Okay, does anybody else have any other questions regarding the nursing home? Member Metzger.
I don't have any questions. I just want to, and I realize the numbers that you have, you know, that we have no cases is, you know, we're hopeful that that's 100% accurate, but that is a reflection on the work that's been done. And I want the staff to understand that we recognize their efforts. So again, that's not to say that we absolutely don't have any. We certainly, it appears we don't, and we want to continue to be that way. And the efforts that are being made are being recognized, and we appreciate that.
Member Gordon.
Thank you, Madam Chairman. I have a question that is not related to COVID-19. I thought the executive summary, first of all, I will echo the same sentiments that have already been expressed. This is a very good summary of where we hope to be heading with regard to the nursing home. I don't recall, and that could be a problem for me, I don't recall seeing reference in the summary to the Blue Ribbon Panel. How do these efforts interlock, interconnect with things that the Blue Ribbon Panel were asked, the Blue Ribbon Panel was asked to do, and that and some of the things that have been done as a result of those recommendations.
Absolutely. I think that's a very good observation. One of the things that comes to mind right away is upgrades to the facility, for example, and the Blue Ribbon panel made some strong suggestions about perhaps having a few more private rooms or building the entryway to be a lot more welcoming. What I do allude to in my summary, Member Gordon, is that we're also challenged with finding ways to address some of the life safety code upgrades, and we're working closely with a vendor. And I want to be careful as we balance the priorities of fixing those particular issues that are related to the physical plant, while simultaneously working a little more downstream to address those types of upgrades. The other thing that was very strong in the Blue Ribbon recommendations, as you might recall, is that we move away from agency staffing and become more reliant upon our own staffing. And in my improvements of the financial performance and quality of care, I also allude to increases in certain staff to deal with particular issues that relate to things like pressure sores and ulcers. And all of that ties in for me as a similar theme, because what I want to do is be able to look at the organizational chart, see our weight of agency staff, and know that we're also then on top of that using our new HR manager to freshen up our recruitment and selection strategies and make us more viable and marketable to folks wanting to come to us and be a McLean County employee at the nursing home. So it isn't really all nicely laid out here in a blueprint just yet, but we are definitely still incorporating the Blue Ribbon panel recommendations. And in fact, we're still involved with them. We convened them virtually in a venue just like this a few days ago to talk about recruitment and selection and to talk about the empty wing of the nursing home, and is it still a viable thing to consider filling with a business opportunity during COVID. So they're definitely still involved, and in future iterations of this, which is really more obviously like an executive memo, we do plan to bring you some more concrete timelines of what we're going to tackle and include those Blue Ribbon committee recommendations.
Thank you. Anybody else have any other questions? Member Chung.
Thank you, Madam Chair. I was just wondering about, I know that Ms. Rodriguez said that they're going to be possibly doing interviews for the new administrator in this next week. Is that what she said? Is there a timeline? I guess, is there a timeline that we have set as to when we want to try and get a new administrator in place by?
Sure. I did have to extend, thank you for the question, Member Chung. I did have to extend the posting. I only had it up initially for 2 weeks, and we did post again for another 2. My goal would be within the next, let's see, now it is beginning of May. I would hope by June 1st to have someone, if in fact these initial interviews lead to someone that I'm willing to bring in for a second interview. That's a hopeful timeline, obviously, especially if we're looking for someone who has an active license in good standing, and obviously if all of their references check out. But until then, we're all hands on deck here. I have submitted my paperwork for a temporary license, and that is a good par for the course. Just because we want to stay in good with all of our licensing requirements. And so we are covered in that regard, but we definitely want to find a strong leader as soon as we can, while still following all the really good practices of doing thorough first and second interviews and reference checks.
Anyone else? I have a question on your general report, that there were only, well, our census is down,
Yes.
and so that there were only 2 admits when we had been averaging a little bit higher than that. Is that a reflection of just the time that we're in, you know, with COVID, that people aren't maybe going and taking their loved one into a nursing home and trying to keep them at home longer? Or have you noticed anything on that?
We have noticed an industry trend of less movement, less admits. And so we're working hard to keep our connections going with all of our normal referral sources, but we have noticed a slowdown. And so, but even just today, I think I got an email right before I came in to say we had another admit. So hopefully now that things are, I don't want to jump out there and say stabilized, but that folks are getting a little more used to this environment that we are living in. I hope we see an uptick more so than we did last month.
Thank you. Anyone else have questions for Ms. Rodriguez on the nursing home? Okay.
Thank you.
Seeing none, we'll move on. Next is Michelle Welch and Jason Tab from Adult and Juvenile Detention, and they are not present. And so if you have any questions regarding their general report or any other questions, Ms. Rodriguez will attempt to answer them. And if not, we can see where we can go from there.
We did, Chairman Schaefer, we did make sure that they were available for a call. And so they are watching via YouTube or Facebook Live, although there's a little delay with that. But you should know that weeks ago, I started meeting with them twice a week over the phone with all of the medically oriented portions of our facility. So I'm fairly up to date on how things are going at both of their shops, but I'll try hard to answer your questions.
Anyone have any questions regarding adult or juvenile detention medical? Okay, moving on. Next is Jessica McKnight, Health Department Administrator. And is she in your room there?
Yeah, gonna come up to the podium.
Okay.
Here she is.
Here she is.
Okay. Hello there.
Hi.
You have 2 items for action. The first one is request approval of position reclassifications. Can I have a motion for that, please? Motion by Chung, second by Martin. Would you want to explain that to the committee?
So I guess just a little bit of explaining is that our finance director had resigned a couple of months ago. And so we have 2 accounting specialists that were already on staff and feel that they can take on those duties and split the duties that were being done by the finance director. And then with myself also doing other budgeting items, that we could absorb that position. And therefore, with their added duties would be, I guess is the right word, promoting then. So those positions. And then the behavioral health specialist, then we have the ability with the savings in the budget to then add that needed position to really help us with community initiatives.
Any questions from Ms. McKnight on the first item? Okay, and then I must, did you have a question, Ms. Metzger? Okay, I guess then we're ready to vote. All in favor? Raise your hand. Any opposed? Okay, that passes. The other item is a resolution amending the funded full-time equivalent position resolution for fiscal year 2020. Motion on that one, please. Motion by Gordon, second by Chung. You want to explain that?
Okay, I think I might have explained it in conjunction with the other one as well. I'm sorry.
One has to go with the other.
Yeah, one was
Yeah,
available.
right.
Yeah.
Anyone have any questions regarding the resolution? Okay, all in favor, raise your hand. Any opposed? And that passes. And then you have your general report. Does
So
anybody have any questions, or did you want to elaborate on anything on that?
just really, are there any questions about what was in it? it was similar to last month, just with some updates really, and then including more information about new cases and then testing.
And we're up to 100, over 100 now.
Today, yes, yeah.
Ms. Metzger.
We're continuing to, most recently, we have begun to see an uptick again, and I'm assuming that that is probably because of the frequency or the ability to test more, or are we truly seeing a uptick, I guess is my question.
Yeah, it's hard to determine where exactly that's coming from, but we have seen our highest numbers from the community-based testing site in the last couple of days. So I think it was Friday, we had 200, and we have the capacity to do 250 out of that site. So we've definitely seen more testing being done. And as we do more testing, we will of course find more virus.
So I don't know if you have this information or not. Are the people, because they've loosened the guidance or the who can be tested out there now to pretty much anybody, correct?
Yes, yeah, the guidance is you do have to be symptomatic unless you are a first responder, healthcare worker, or any essential employee. So anyone who is considered essential can go with or without symptoms.
So are there more essential employees going? I mean, since we have a whole lot more, you know, we had over 200, I'm guessing that maybe some of those people may have been ones that had not been going before because they were not symptomatic. Do we have any of that kind of information as to actually if they're first responders or they're, you know, essential workers or any kind of thing like that?
I don't, but it was definitely something we were talking about today of maybe reaching out to the testing site and seeing are they even keeping tally of who and what those individuals are getting tested, because we've had that question several times to know where are the increases coming from. Is it because of the loosened testing criteria? So I can reach out to IDPH, our partners that are really overseeing that site, to see if that is information that they're collecting and then compiling.
Member Robustelli.
Yeah, I want to take that to the next logical place, which is just how we're communicating about this. So first, I just want to say I really am very impressed with the social media and all of the ways in which the health department and the county is pushing information. I think it's really exemplar. But I know that oftentimes that's all that we can do. And so I wonder internally with our own staff, especially those that are now eligible for testing, if you could share a little bit about how our correction officers, our the sheriff deputies, anyone that fits that essential work, anybody who's working for the county has been notified that they are eligible for this testing and encouraged to consider it. And then the second part is how we are pushing this information to the grocery shoppers and all those, the grocery workers and all those who are essential workers out in the community. Because one of the things that I was talking with somebody about, a constituent called me, said, you know, there are lots of people that have some expertise and time on their hands, and there may be an opportunity for us to put together some volunteers who can do some guerrilla marketing on our behalf, take the information and expand on it, sort of the butterfly effect of marketing and public relations. So I just wonder if, I know we have the medical brigade program and that's focused on healthcare service providers, but we also have a need to market and communicate in the community about new information. And I wonder if we can build on the great work that's being done in the channels and take it to the next level. So those are two parts question, internal and external, and I'll turn it over to you. Thanks.
So internally, county admin has been, you know, really good about helping us get that out to all county employees. We're doing a lot of that promotion also to our staff. We do several weekly staff updates, and that's always included in that, reminding them that they are essential employees. So we're doing a lot of that internally, marketing that. And then externally, we've been really utilizing our relationships with especially the grocery stores and restaurants through our environmental health department to get that information to their employees. And then, that is something though that we could continue to explore other ways to do it. So yeah, those are good ideas of, if we know of people who are currently, had that capacity to help us market, we have been looking for different ways to get this testing site promoted. So any ideas are great.
I would just say, if you go that avenue, please let us all know, because we have networks that we can circulate. And so if you're looking for a particular expertise or something that would help us as we move our communication strategy forward, I think there are a lot of people in the community right now that, that they could help support us, and we could put a volunteer group together that you check in with weekly or bi-weekly, just to say, here's all the tools we put there. Help push this out in whatever way you'd like to. And they could be very creative about it and reach more people in the process. So just let us know if you end up going down that road, and I'll be happy to help reach out to people I know, and I'm sure others would as well.
Great, and if I may, I think Ms. McKnight and I talk probably every day, at least once a day, about this particular subject. And I've been interviewing a couple of local college students who are interested in interning for us this summer, sooner than later, who are social media influencers. I'm learning about this concept, as you mentioned, the marketing on our behalf, and they were trying to teach me that we could do more even with less by using that social media influencing concept. And so I'm excited to hopefully have the opportunity to work with at least one, if not two, interns this summer. And summer means very soon, because they're ready. They've been working remotely on their studies, and they're just ready to switch over to another learning opportunity. So Ms. McKnight and I have been working on the possibilities of that as well.
And prior to my previous meeting today, there was a little bit of discussion that Connect Transit is working and talking to the site about having actually a walk-up clinic, or taking buses there too. So that would help some of those types of workers, the ones that are essential workers that work in the groceries, that may even take, public transportation to work, that don't have transportation. And maybe that's also been a deterrent for people not going out there. And so hopefully that can come to fruition and get more people, because there is at least one site on the south side of Chicago, I believe, that has both a drive-through and a walk-up part of it. So people that can take public transportation can get tested. So I think that's another thing that maybe we'll hopefully in the near future we can be talking about or hearing about as another option for people. Anyone else? Member Metzger.
When Ms. McKnight was talking, I got the impression that the statistics that from the testing site are either not shared or they're not being collected. Am I accurate? Because my next question would be, how many people have been retested?
Yeah, so we do get daily numbers of people tested, and that's currently all we get. I'm not sure, again, what information they are actually taking and compiling. There's demographic information that is collected, but I don't know if anything is being done with that, but I will definitely check into that. I do know that people are being tested repeatedly. I just don't know if that's even something that's being looked at.
So have we requested statistical information, or it's just they're not willing to give it, or you don't know that?
have not requested that yet. We only are getting the numbers right now, but we can definitely look into different areas.
And this is a regional site, so people who are tested may not be from McLean County, correct?
Correct.
Any other questions for Ms. McKnight? Okay, thank you.
Thank you.
Next up is Ms. Rodriguez, County Administrator.
Thank you. Thank you, Chairman Schaefer. I really only have one item just for information, which is my regular report on recent employment activities on page 40. If you have any questions, I'd be happy to answer.
Anybody have any questions for Ms. Rodriguez? Does anybody have any other business or communication? If not, then we have bills to pay. I have the memo from the auditor that has reviewed all the bills and they comply with all of our policies. And so with that, the nursing home has a prepaid total of $235,754.75. Motion by Metzger, second by Robustelli. All in favor? Raise your hand. Any opposed? Okay, that one passes. Developmental Disabilities Board has a prepaid total of $1,164.33. Motion by Gordon, second by Chung. All in favor? Any opposed? That one passes. Jail and JDC Medical have a prepaid total of $27,312.18. Motion by Robustelli, second by Metzger. All in favor? Any opposed? Okay, that one passes. And the last one is Board of Health has a prepaid total of $69,126.43. Motion by Gordon, second by Chung. All in favor? Any opposed? And that one passes. And with that, we have no other business. Our next meeting is June 1st, and we are adjourned. Thank you.
Everybody.